everybody. We're going to be bandaging up Mackenzie's hand right now. We're doing her right hand, and the first step is to wrap her thumb. We wrap her thumb using what we call a cross strip. This is actually 2 pieces of Mepitel put together so that it has greater strength. And our goal in using this strip is to open her hand, because reflexively when you pull back on the thumb, it forces a baby to open their fingers. So you bend it into her palm. And you want to come around to the top of the hands, not the bottom of the hands. So we're going to pull this one around here, and you wrap it like one of the AIDS or the autism awareness ribbons. Now, if you were here assisting in the situation, I would probably be the one wrapping. And then the assistant's job would be to continually pat Makenzie. And if possible, to hand materials. So see how I'm going to bend her thumb back now, and it's making her fingers open up. You just want to watch that the Mepitel doesn't really wrinkle too much. There we go. And I know it seems like there's a lot of pressure right now, but what we do is we leave it like this for now, and then when we go to wrap her later on, we release the pressure. So we're going to do the first finger, and it has a notch at the end of the finger strip. This is what a finger strip looks like. And you start at the end of the finger, and you kind of pinwheel your way around, trying to cover, the entire digit. And you're overlapping just a little bit each time around so that it's a full coverage. And then when we come around here, bringing all of the strips of the Mepitel into one location so that the person who's holding is going to use their thumb to hold everything. And as you wrap, Makenzie tends to then leave her fingers open, making it a little bit easier. So she's, very good today, sleeping through most of the bandage change, and even then she still fights us sometimes. But, chances are if it's an emergency situation and a bandage has come off, you need to, creatively pat her and soothe her. We have rattles and things to calm her down. We're looping around again. We're going to go one more time because we want to reduce the amount of friction between the fingers. This one's bending a little. Okay. This one's a little short. And then when you come through, if you can, you want to bend the Mepitel so that you're getting as much coverage as possible between the fingers. That will have to fix. So the Mepitel is our base layer. It mimics sort of the skin. It has the dimples or the little holes to allow whatever your ointment is through and air. That's Crosby playing upstairs in his room. So you also want to, when you're wrapping the fingers, you need to, which way? This way, right? You need to switch and go, is this clockwise or counterclockwise? Counterclockwise? Clockwise. So that you're ending, instead of ending coming around, you want to end over there. I have to think about it every time I do it. So now all of the fingers are wrapped, and we're doing this because Makenzie still has a tendency to rub her fingers together, and that could cause friction and create a blister. A couple of times we've left, you know, her hands unbandaged for a period. You can release for a second. Okay, can I have the scissors, please? And can you just cut? This one's a little long. Thank you. And I just want to double check this.
Is that okay with the?
Yeah, because it's folded, but it's folded on top of another piece of the Makezie. So you just want to make it as flat and as unwrinkled as possible. So after you've bandaged all of the fingers and done the cross strip, we're going to use a piece of Makezie that we call the mitten. It's notched out so that it loops around by the thumb. Okay, so Mimi, so your job would be to hold the fingers. And if you were assisting in a bandage change, that would also be your job. And you want to sort of make the notch as level with where her thumb is as possible, so you're covering the entire palm. The goal of the mitten is to sort of bind together her four fingers so that we're reducing the movement, which makes it more likely for her to throw the bandage. You're going to have to move your thumb, Mimi.
Yeah.
This needs to be taut. We're sort of going to loop around now, and we're going to come around to the thumb. We want to make sure that, you know, she still has movement and we're not restricting the blood flow in any way. If you needed to at this point, you would adjust your cross strip again. And now at this point, we're going to come around. That needs to be flat if possible.
Okay, baby. Okay.
You're constantly trying to make sure that the Makezie is as flat as possible. And avoid wrinkles. It's hard, particularly with the hands, because we have so many things coming into the one location.
I'll take this off.
Yep. The concern, I mean, it shouldn't affect her skin. The Makezie, once it's buttered with the ointment, becomes very flexible. Because it's silicone, so it heats up from her skin. And then, you know, sort of, like I said, acts as another layer of skin for her to protect her actual skin. So this is called the mummy strip. It's just a long strip of the Makezie. We use that, we pick up where we left off with the mitten. In the past, we would probably have stopped down here, but she's had some erosions on the elbows, so we're going up over the elbow currently. You can see the old erosions right here until they're fully healed. So you keep wrapping around, and then on your final loop around, you want to make it as straight as possible. No, those are, I use the blue ones, yeah. The other ones are the large. Okay. And then if you end up with a little bit of a bend here, you can just kind of fold it over because you're on top of another piece of the Makezie. So that's the Makezie base layer. And now we're going to butter her with Vaseline on all of the fingers, and then with a little bit of polysporin at the elbow. As long as she has no open areas, you can just use the Vaseline. If there's areas that are healing or areas that are open, then we use an antibiotic ointment. We alternate the ointments every month so that we're avoiding developing any resistant bacteria on her skin. All right, so now I'm going to add just a little bit of polysporin at the elbow. Now the challenge is once the Makezie is buttered like it is right now, it becomes really super slimy. So if she was not passed out right now, she would probably be moving her arm, and then these layers right here have a tendency to move. So when you're bandaging with her, can I have the Vaseline gauze? Thank you. The assistant would then kind of help put those layers back in place as the other person starts to do the Vaseline gauze. So we cut a hole in here for her thumb, and that serves as another way to secure the bandage. Our goal in a lot of this is to come up with as many ways as possible to secure the bandages so that she doesn't throw them off later in the day. This particular procedure that we're showing you has been very successful for us. We have started to experiment now that it's getting warmer with leaving off certain layers. And she has thrown bandages. And if I'm home alone with her, that becomes an issue because I can't get the bandage back on by myself. So hopefully, by doing this video, it'll allow other people to learn enough to be able to just assist in a bandage change in an emergency situation. So again, we're trying to avoid the wrinkles. And we're wrapping all the way around, and you can see how the Mepitel has started to slide. So you want to just kind of push it back into place. And again, because it gets so slimy, the Vaseline gauze is used to hold the Mepitel in place. It tends to get very stringy, so you want to try and avoid having those close to her skin because they dry out very quickly and then they rub. So we're going to cut the Vaseline gauze right about here. We're going to butter it at the top, particularly because she had that erosion, with a little bit more Vaseline. This is also the area that's most prone to drying out. Next up, we're going to do a transfer at the top. And again, the transfer at the top, we think, provides a different layer of security in meeting up with the telfa and the cling and her sock. And again, we try to just line these up with the end of the Vaseline gauze and the Mepitel. And this keeps things, I think, a little bit moister than just the telfa and the cling itself, especially since this is at a joint where she tends to have, more erosions just because of the fact that she moves more there. So then we tape this off. You have to be very careful about what goes next to her skin. This particular tape is, on a typical baby, would be fine on their skin. For Makenzie, we try to avoid having anything touch her skin because we never know what might take skin away. All right, so these are our just regular squares of telfa. And we're gonna actually turn it like this. So we line up the 2 squares of telfa. And you wanna, again, make sure that there's no gaps in the telfa. And keep your cling as flat as possible. Okay, so then we're gonna go over the top. This particular piece is notched in 2 locations so that it will bend around Makenzie's hands.
I just can't wait.
Uncle Ben is coming to visit today, Crosby. Just can't wait to see him. He's super excited. All right, so we've secured our large 2 pieces of telfa, and now we're going to come around and we're going to secure this telfa on the top of her hands, again avoiding any gaps because that lets in air, and once you let in air, it causes the Vaseline gauze to dry out. The concern then is that it creates friction. All right, so we go around one way, cover this side, come around here, cover this side, and then we continue to come down. Again, you want to use the minimum amount of cling possible so that you're keeping down the bulk. So we we just keep looping around, making sure your telfa is flat as possible. And so the cling is keeping the telfa on top of the transfer, and all of these layers together with the sock seem to create an area that secures the bandage better. All right, so we're gonna cut and tape this off. And then we are gonna cover this with a sock. And we still, I mean, we do have some other products now that we could use, but the socks seem to work the best for Makenzie on her hands, and they're definitely the softest, at least until they've, you know, she's worn them a bunch of times and there's too much aquaphor. And this is a completed bandage of Makenzie's hand.